Hi friends, welcome back to my channel. Today's video is all about OET speaking. Do you know the factors which will help you to improve your speaking score? Anyhow, no need to worry. Today we are going to discuss how you can improve your scoring, or no one can prevent you from getting 350 or even 400 above if you speak like this. So let's listen to the tips. First and foremost, it should be a normal talk. That is the first thing we keep in our mind, even though it's an exam. In our mind, we may feel panic because usually during exam, even though we are confident or fluent, there will be some stress. So in that way, may get panic and it can affect our score. So in order to prevent these things, what we can do? Just reiterate in your mind, yes, I can do it. So make yourself confident and give faith to God. Then just practice in a proper way. I am going to give those tips how we can do it naturally. When it will become a normal talk, there is nothing to worry. When we are talking to our friends or relatives or colleagues, whoever may come, we are not getting panic, isn't it? So in that way, if we do the normal talk means you can speak naturally and you will crack the OET speaking. So it is a conversation. So there is no need to get alarm or something. So in just try to practice in the normal way. So as I told you before, should be a normal talk. Don't use templates, or if in case you are practicing some templates like that. Usually we are in our OIT speaking, we are using, oh, no need to worry, I can understand your situation, like that. The phrases we are overly using, but if you are using that one, no problem, but just try to make it in a natural way. They should feel you are. How we can achieve that one? Just by the modulation of your voice. There should be up and down in your sounds. It should not be monotonous. Then, for example, when we are getting this 3 minutes preparation time, we have to understand clearly, a crystal clear explanation you should be able to get provide from this after reading this role play card. So don't get distracted during that time. Just use that time wisely. Okay? It should be a you should get a precise idea from this role play task. So let's see this task. Setting is hospital ward. So we understood the setting is hospital ward. Then our role is a nurse. So you have been called to the patient bedside. This is the background situation. So let's read. You have been called to the patient's bedside. The patient was supposed to go in for his surgery at 10 a.m. and was second on the list, but surgery was delayed because the previous patient had some complications during surgery. Apparently, he had never had an anesthetic before and was suffering from post-op vomiting. Hadn't passed urine and is in pain. This is all about the first patient, not about this patient. That's why it was this patient's procedure was done. Then he had some post-operative complications due to this vomiting like that, and he didn't pass urine. That's why they couldn't take this patient out, and this patient's surgery is delayed. We should understand the situation clearly. The patient's daughter is very angry and wants to talk to you. So this is the background situation. Then the task. Why they are providing this task, do you know? because they are providing this task. Just they are provide some hints or clues for you to start this conversation and how to go through it, how we can continue the conversation. Just they are providing some clues, but it doesn't mean you must follow only these questions or ask only this question or clarify their doubts. You can use from your side itself. For example, if you are saying, don't imagine this is a patient, just say like it's your neighbor or some friends or like that, and they had some problem. And when you saw that they're telling, oh, I have severe pain like that, then what you are usually asking, oh, really? I'm so sorry to hear that. We will tell, no? Then what we can do? Then we are, oh, where is the pain? Like that we will ask. Then they are, oh, is it severe? In our normal talk, we are asking, like, and did you take something like that? No, if we say, or have you consulted any doctor? Like that, we will ask. So, like that, we should ask. Why I am telling to imagine like a friend or neighbor, somebody like that, because as an as I know, it's quite difficult. We are quite busy, and these days, due to shortage of staff, we may not able to ask the patient and stay with the patient for long time. To ask like this, where I know we just provide medication, the communication between the patient and nurse is very less. So if we imagine our friends or something like that, we naturally ask these questions to them. So that's why I asked. So it will come in your mind. Oh, did you take any pain medication, or how are you feeling now? We are commonly asking these questions. What else we are doing? Then we will tell. Hey, no need to worry. The doctor, if you go to that hospital, this is very famous for this surgery. Then you will get well soon. And I have seen many people went there and they all recovered very well. We are usually telling like that, no? Then we will tell, no, I will pray for you. Like that, we are just consoling our friends. So then we will suggest something from, when I heard this pain, I did like this. I took this medication. Maybe it will be helpful for you. And you can just elevate your, if some swelling or something like that, you just elevate with the pillow. It can help you. Some the home remedies we will suggest, no? Like that points we can also include in our OET speaking. It doesn't matter, you can just get the points from this task and as well. Don't go directly to the task. You should communicate with the patient and make a relationship before that itself. Is it clear for you? Yeah. So here the patient has just called, not the patient, the relative. She called. So we are going there. We heard this patient call. Nurse call bell system is activated or the buzzer is activated. So we, I understand you have activated the nurse call system. So could you please tell me what's bothering? How can I help you? So if the patient daughter is very angry and she's upset, she will tell me. Then we can, what we can tell. I'm so sorry to hear that. I really apologize for the inconvenience with you. I can explain the reason behind that. So once they understand the reason, they may become calm, or still they may argue about this patient here. See, they gave the task, find out why the patient's daughter is angry. Then empathize with the daughter about the delay, but be realistic about how long the patient may have to wait. Then we can just give some time. Oh, only it will take this much time. That's already, this is the problem happened, like that we can tell them. If you explain in detail and about the previous patient's comment, there is a chance to understand. Then to prevent fear, if the patient, the daughter is insisting her father to be discharged to other hospital, then we can just tell her, if you go to the other and his condition is not safe to transfer to other hospital, and even though you go there, they may start from the beginning itself. They have to perform all investigations and it will delay your father's surgery, like that. Try to convince them, then it will be okay. Then you should appreciate them for the cooperation, like that. Then another factor is the grammatical errors. Please practice all tenses so you can avoid these grammar mistakes and be calm. Don't get tensed. Don't be panic. Just be go through this task carefully and understand very well and for all the best for your thank you. Thank you for supporting me and keep watching. You can also practice some grammar in my community tab. I can see many are making some mistakes. So keep practicing grammars to improve your writing and speaking especially. Okay. Thank you.